Okay, I did my topic over patellofemoral pain syndrome and how physical therapy affects people with it, how physical therapy can contribute to helping that patient get better and helping that patient, get going and doing things that they used to be able to do. Alright, so patellofemoral pain syndrome is a condition characterized by pain occurring in the anterior portion of the knee, specifically right under the kneecap, also known as the patella. Typically people that get this are very active people, so therefore it's also called runner's knee. So research shows that women are more affected than men to develop this syndrome because a woman's pelvis typically is a little bit more wider because of having to go through childbirth. So whenever the hips and the pelvis are more wide, that means that increases the angle at which your knees align with your pelvis. So therefore your knees are caving in a little bit, causing them to go in, kind of affecting that tracking of the patella a little bit. Therefore, that'll add a little bit more stress onto the patella itself. So when people get diagnosed with this, as explained by the University of California, San Francisco Health Clinic, the diagnosis begins by the physician asking questions such as the activity level, when the pain began, how long they've been experiencing this. They will then kind of feel around a little bit to see where they're most tender. And then if they're still unsure, they will get x-rays, an MRI if needed, and then they will kind of go from there, see how the patella is tracking to make sure it's tracking right. They may even test the strength of some muscles in the legs to see if that could possibly have an effect on the patellofemoral pain syndrome. So the most common complaint that individuals with patellofemoral pain syndrome have, is just pain in the anterior knee, like I had said before, or loss of function, not being able to complete what they want to, their everyday function, as well as they used to, or even, things such as running, climbing up the steps, squatting, anything that really puts a lot of stress on the front of the kneecap. So one of the main things that physical therapy likes to focus on with patients with patellofemoral pain syndrome is, 1, we want to reduce pain, and 2, we want to help strengthen the muscles that are weak that could be causing this problem, and we also want to make sure we maintain that normal range of motion of knee flexion, knee extension, to make sure that kneecap is tracking right, like I had said before. So usually when patients that have patellofemoral pain syndrome, usually some muscles that are weak would be their quadriceps in the front of the thigh, the adductors on the inside of the thigh, the glutes, and the obliques. So therefore, hip strengthening and knee strengthening is very, very beneficial with patients with patellofemoral pain syndrome. So kind of like what I said before, the more the patient experiences these symptoms, the less they will be able to perform their functional and daily activities because the pain limits their ability to do so. So a couple things that I read. There was a study that I read, and they had said that kinesiotaping can help strengthen those muscles and increase that joint stability, increase joint mobility, and so therefore you'll put tape. There will be certain ways to lay the tape down on the knee to make sure that the patient's knee is fully supported, because if those muscles aren't fully supporting that kneecap and making sure the muscles and the ligaments are supporting that kneecap, it is very important to make sure something else is there to support it, so that your knee is not super unstable. So that's why we sometimes provide kinesiotaping is kind of just like a proprioceptive technique, just to reassure you that you do have stability in the knee. Another thing that could be causing patellofemoral pain syndrome is flat foot. So flat foot also means that your feet are pronated, so that you, when your feet are pronated, that means the alignment of your knee, your hip, knee, and foot are all off balance, which is pretty common. That's why we need to focus on really strengthening those hips to help widen those, or to help pull that knee laterally to avoid that valgus stress on the inside of the knee. So therefore, if your foot is pronated, your knees will go inward, as we call valgus stress, and that will also increase the Q angle in your hip. The Q angle is from your iliac crest down through the middle of patella, and then up through your kneecap, straight up. And typically, females have about a 15-degree Q angle, and males is typically 10 degrees. So females is typically already higher, and so typically women with this dysfunction is a little more increased. So we don't want to increase that any more than we need to. And kind of like what I had mentioned, women are already at a greater risk at developing this syndrome because of those reasons. So some other reasons besides strengthening that could affect patellofemoral pain syndrome could possibly be like a previous history of a dislocation, a fracture, just excessive stress on the patella just from using it too much, and weakness of muscles, like I had said, softening cartilage around the patella, and maybe surgeries that have involved the ACL, because that also causes an instability. So that with the patellofemoral pain syndrome, just a lose-lose situation. So besides kinesiotaping, a couple other things that we as therapists do. So we just do exercise therapy. So we, like I said, we strengthen the hips, the knees, and we also use ultrasound and electrical stimulation. So with ultrasound, one of the studies that I read, they did underwater ultrasound, and it was performed at a certain intensity, and they performed the ultrasound to help decrease the inflammation, because with that stress and overuse on the patella, it sometimes causes inflammation in the knee. So therefore, this modality can help decrease that pain and that inflammation, because when you have increased inflammation in a joint, it also limits your range of motion, and that's kind of what we're trying to get back to, is that normal range of motion in the knee. Also, like I said, electrical stimulation is also very, very beneficial because it helps reduce the pain as well. It feels like pins and needles, and it sends electrical stimulation through one part of the muscle, and then comes out through the other part, and the signals go through each other, kind of eliminating, or it kind of helps you think about other things other than the pain you're experiencing. You know, it has the proprioceptive, your nerve endings, so therefore you won't feel the pain as much when you have the E-stim on that, through that muscle or around that joint. Not only, so there's certain types of E-stim you can use. There's one for pain reduction, which I was just explaining. So it helps. So it's interferential or premodulated. Those are the two names of the main ones that we like to use. And then also you can use pulse biphasic current. So pulse biphasic current is a type of electrical stimulation that helps strengthen a muscle. So you really, when you place the pads on the muscle, you want to turn up the intensity to where you see that muscle completely contracting, and then it'll relax. And when you start it, you'll tell the patient what you want them to do, what they're going to feel. So once that intensity speeds up, their muscle will be fully contracting, and then it'll stay contracted for a little bit, and then it will relax. So with it staying contracted for a little bit, you want to make sure the patient is aware of that is going on, because sometimes it is a little bit painful, but in the long run it is definitely beneficial, because it is another way to strengthen that muscle, instead of just your everyday exercises that you would be doing. So one of the other studies that I read, they were explaining about how important it is to strengthen the muscles around your knee and strengthen the muscles around your hips. So most people don't really realize that your hips are a big factor of knee, ankle pain, really anything below it. So people that typically have hip problems or knee problems typically goes hand in hand. So therefore, in the study that I read, they had 3 groups, and one did just the knee strengthening program, one did just the hip strengthening program, and then the last group did the hip and knee strengthening program. And like I kind of was just explaining before, the hip and knee strengthening program definitely was the most beneficial. They showed the best results, decreased pain over time. They definitely had the best results with the 2 hip and knee strengthening program. So what I was kind of saying, along with that, with the kinesiotaping, you can do that, like I mentioned before, you can do kinesiotaping to decrease inflammation, to decrease pain, and even to increase strength. So with that study that I had just mentioned, they also had provided a little bit of tape around the knee joint in one of the groups to see if that had any change in the strength and stability in the knee as well, and it did. So because they did some balance activities, and they had realized that if you have a bad balance, that means you have an instability somewhere, and not only that, but it means if you have an instability somewhere, that means your muscles are weak. So kinesiotaping, strengthening, hip and knee strengthening programs, E-stim, ultrasound, those are all great ways as a therapist to help reduce these symptoms in patients that have patellofemoral pain syndrome. Okay, so a couple other things that a therapist will do. We do transverse friction to the lateral retinaculum, and what this is a manual technique that we do with our hands. And the lateral retinaculum is on the outside of your knee. So what you'll do is we'll just apply some pressure, and it'll break up. So what transverse friction does is when you go back and forth on the area, you push pretty hard, it'll kind of reset that inflammation process to make sure it's healing correctly. So therefore, we typically do this on muscles that aren't healing correctly, or tendons that aren't healing correctly from an injury, to kind of restart that inflammation process so they can restore a normal inflammation process. So that's sometimes why we provide manual therapy to this as well. It's not as common, but if a patient is experiencing this from a fracture, dislocation, anything like this, this is where we may eventually lead to. And they actually did this in one of the other studies that I read, and they had the benefits of that was very high. The patients came in with this pain. The therapist did that manual technique on the lateral retinaculum, the outside of their knee, to kind of release some tension and restart that inflammation process. And the study, what they were trying to get to is to make sure that the patient was able to, effectively go up and down the steps without any pain. And they were at the end of the intervention. So it was very, very helpful. So a couple last things. One other thing that we like to provide to our patients is PNF. So PNF is proprioceptive neuromuscular facilitation, kind of like what I had mentioned a few minutes ago. And so what PNF is, it's a technique that utilizes an individual's nervous system to improve and restore their functional patterns. This technique has been around for a while, probably since about the 1940s, so it's something that has definitely been researched, and research has been backed up on it, so we know that it is very effective. So we like to use, there's a bunch of different techniques you can do with PNF, but like I mentioned before, it's really, it's certain movement patterns that help you return to your functional activities, functional movements, step up, step down, squatting, to make sure that you're functionally able to do the things that you need to do to get around. So with PNF, you can use the upper body or the lower body, and obviously in this aspect we would do different techniques with the lower body. So the different techniques that we would use, some help improve stability, mobility, controlled mobility, and a skill that you're wanting to perform. So you kind of got to start at the beginning and work your way up that spectrum until you reach that skill, which, like I mentioned before, would be probably, squatting, walking up and down the steps, and stuff like that. And then actually, as a group, we proposed a study in our group, and I applied that to this paper. What helps? If PNF patterns help better, if therapeutic exercises work better, and with our reasoning and rationale behind, we would say that PNF patterns with therapeutic activity and exercise would definitely be more beneficial than one versus the other, because they go hand in hand. So the last thing I'm going to talk about is kind of how I related this back to a local standpoint. So kind of how I was saying before, typically it's very common in skinny females who are very, very active. So I ran a poll, and I had got some good feedback from it. I had asked, who has had this syndrome, and I got some responses. A girl responded. She ran cross country at Shawnee State, so I met up with her, asked her some questions. She was telling me the different hip and knee exercises that they had given her. They told her about how important it was to stretch that IT band, your quads, your hamstrings. Make sure you're keeping those muscles loose, but also keeping your hips and knees strengthened, because those become very, very weak as we age, especially in women. They also told her to do exercises at home to make sure that she kept up on this, and they didn't want her pain to come back after time. So you do have to keep up on your exercises and your stretches that your therapist provides for you. So overall, there are many great things you can do to help alleviate pain, inflammation, increase motion in patients with patellofemoral pain syndrome, such as kinesiotaping, ultrasound, electrical stimulation, therapeutic exercise, therapeutic activity, hip and knee strengthening programs. They all really go hand in hand with each other. They all work together to kind of come out with the same outcome, and we as well have the same outcome that the patient wants. They're in our best interest. We want them to fully return to what they were able to do before they started having these symptoms. So we really want them to get back to their normal function pain-free, and that is our main goal as therapists.